Welcome to the Learning, Leadership, and Professionalism module, Part 1. Our objectives for this module are to provide an introduction to leadership styles, discuss the behaviors and actions of successful nurse leaders, review the opportunities associated with professional organizations, and briefly discuss formalized continuing education and certifications. There are several different leadership styles in nursing management, each with benefits and detractors in their use and effectiveness towards achieving organizational goals. As a nursing leader, it is important to have a comprehensive understanding of these styles and then to determine how your strengths and weaknesses fit into each of these categories so that you might focus your efforts on improving your present skills and abilities. Coined by Robert K. Greenleaf in 1970, the term servant leadership refers to leaders who influence and motivate others by building relationships and developing the skills of individual team members. Servant leadership in nursing implies that a leader naturally cares about ensuring each team member has the resources and tools they need to succeed. Per Franzen, characteristic skills of a servant leader include listening, acceptance, awareness, persuasion, foresight, commitment to the growth of others, and building community within the organization. Transformational leadership is a management style that motivates employees to take ownership for their roles and perform beyond expectations. It is based on building relationships and motivating staff members through a shared vision and mission. Transformational leaders typically have charisma to communicate vision, confidence to act in a way that inspires others, staffed respect and loyalty from letting the team know they are important, excel at conflict resolution, and are masters at helping people do things they weren't sure they could do by giving encouragement and praise. Democratic leaders encourage open communication and staff participation in decisions. Democratic leadership in nursing can work well to ensure the team feels valued and comfortable speaking up. Workers are given responsibility, accountability, and feedback regarding their performance. Relationships are important to this leader who places a focus on quality improvement of systems and processes rather than mistakes of individual team members. The authoritarian or autocratic leadership style is demonstrated when a leader makes all decisions without considerations and input from staff. Negative reinforcement and punishment are often used to enforce rules. Because knowledge is seen as power, critical information may be withheld from the team. Mistakes are not tolerated and blame is placed on individuals rather than on faulty processes. The positive side of this style is that it works perfectly in emergencies or chaotic situations where there is little time for discussion. It is useful when enforcing policies and procedures that protect resident health and safety, but it does not promote trust, communication, or teamwork when used for day-to-day operations. Authoritarian leaders are often micromanagers. Conversely, laissez-faire leadership is a style in which leader provides little or no direction or supervision and prefers to take a hands-off approach. This information presented is informative and does not constitute direct legal or regulatory advice. Decisions are not made, changes rarely occur, and quality improvement is typically reactive, not proactive. It is most often used by new, inexperienced leaders or by those at the end of their career who choose not to address issues since things will soon be changed by their replacement leader. Nurses practice in a turbulent, ever-evolving healthcare environment. In order to meet today's challenges and opportunities while strategically planning for the future, it is crucial that we expand our knowledge base and utilization of evidence-based practice principles. Interdisciplinary strategies, including collaboration, communication, and strategically driven partnerships, are an essential component to assuring we can effectively meet these standards. According to Marcia Hughes Reese, one way to facilitate interprofessional collaboration and accelerate the change process is to identify your stakeholders at the very beginning and develop action steps to ensure their commitment to achieving the goal. Suggestions for stakeholder commitment mapping include: brainstorm which stakeholders should be included as part of the change initiative or could be impacted by the change initiative. Identify the current commitment of the individual or group to the change initiative. Develop action strategies to move the individual or group from its current level of commitment to the desired level of commitment. If you know you already have some members of a group who support the change initiative, enlist their help in developing strategies to target their colleagues. Determine the critical mass of individuals or groups that you believe is needed to align with the change agenda to ensure success. The Future of Nursing, Leading Change, Advancing Health report from the Institute of Medicine offers recommendations that emphasize the critical intersection between the health needs of populations and the actions of nurses. Another recommendation calls for private and public funders, healthcare organizations, nursing education programs, and nursing associations to expand opportunities for nurses to lead and disseminate the results of collaborative improvement efforts to redesign and improve practice environments and systems. Academic practice partnerships, or APPs, positively impact patient outcomes, patient satisfaction with care services, nursing outcomes, and student learners. These partnerships provide a formalized means for academic partners to share educational resources with healthcare institutions towards translating evidence-based practice, or EBP, principles to improve clinical decision-making, increase knowledge of EBP, and inspire the growth of EBP population health initiatives. Student learners immersed in APP settings become experienced in EBP analysis and translation, while growing their ability to become skilled, compassionate caregivers and attentive patient advocates. In a study conducted by Beal, administrators, educators, and researchers agreed that an effective partnership requires shared vision, decision-making, mutual investment, common goals, and must be based on mutual trust and respect. Further, the authors found that personal relationships, open and free communication, and frequent contact and engagement were the foundation of successful academic practice partnerships. Further, APPs serve as a unique strategy to reduce nursing shortages among participating healthcare facilities. According to Franzen, a team is not just a group of people who are directed by one leader. Every person on the team has a role to play, and these combined roles contribute to the overall big picture. It is the responsibility of the nurse leader to help others grasp the big picture by continually keeping in the forefront a vision of where the team needs to go. The social process by which people interact and behave in a group environment is called group dynamics. It involves the influence of personality, power, and behavior on the group. Nazzaro and Strasbosco describe the two most common roles affecting a group's effectiveness are the person who dominates and the person who remains silent. It can be as difficult to get the quiet person to speak as it is to get the talkative person to talk less. Please read Group Dynamics and Team Building by Nazzaro and Strasbosco for detailed information on establishing group roles, problem solving, team building, and development. According to the Academy of Medical Surgical Nurses, mentoring is a reciprocal and collaborative learning relationship between two, sometimes more, individuals with mutual goals and shared accountability for the outcomes and success of their relationship. The Academy states that mentoring can guide nurses in their professional, personal, and interpersonal growth. According to the Robert Wood Johnson Foundation, mentoring helps cultivate nurse leaders, retain nurses, and diversify the nursing workforce. By strengthening the nursing workforce, nursing mentorship improves the quality of patient care and outcomes. The foundation identifies 3 specific benefits. 1, mentoring can foster the leadership skills that nurses need to secure larger roles in developing, designing, and delivering healthcare. 2, mentoring relationships inside the healthcare organizations and academic institutions can help those organizations retain nurses and nurse educators, reducing the cost of turnover. And 3, mentoring can diversify the mostly white and female profession by supporting minority and male nurses. This diversification can lead to fewer health disparities within the population by providing diverse role models. According to mentoring guidelines from the Academy of Medical Surgical Nurses, successful mentoring relationships must build upon trust, openness to self-disclose, affirmation, and willingness and skill in giving and receiving feedback. The guidelines state the following. The mentor and mentee must trust each other. They both must be willing to share information about themselves, including unpleasant experiences they have had. They both must give constructive feedback, positive and negative. Mentors need to let mentees know regularly that they believe the mentee will succeed. At any given point in your career, you will have crucial conversations. These can occur with a coworker, a person in leadership, a physician or practitioner in another health science profession, or with a patient or family member. Crucial Conversations, Tools for Talking When Stakes Are High by Patterson, Grenny, McMillan, and Switzler is a guidebook to set you up for success. Look around you. Who are the people in your life who get things done? Who are those who are most respected? What attitudes, demeanor, and communication style do they bring to the table when stakes are high? How do these people become so influential? Consider this. Each of us enters conversations with our own opinions, feelings, theories, and experiences about the topics at hand. When this collective information is shared in the conversation, it allows others to open up and share their opinions, feelings, etc. Thus, everyone can add meaning to this collective pool of information. As the pool of shared meaning grows, individuals are exposed to more accurate and relevant information, which allows them to make better choices. When your addition to the shared pool of information is respected and validated, you will, in turn, respect and validate others. Thus, not only does this allow everyone to make a better choice, people are more willing to act on whatever decision is made. Crucial conversations take years of observation, practice, more observation, and more practice. Successful nurse leaders will hone this skill over the course of their career and pass it on to their mentees. If you ask any nurse who has been in practice for more than a few months, what has changed since you've been a nurse? More often than not, technology will be on her list. From the med cart with narcotics keys to the Pyxis, from the paper chart to the EMR, technology is part of nurses' evolution. Just like graduating from dial-up internet to 5G, we all adapt and learn to appreciate advantages in safety, efficiency, and workflow with technology in our profession. Nurse leaders need to have a working knowledge of how various types of technology, such as electronic health records, data analytics, predictive modeling, artificial intelligence, speech recognition, natural language processing, robotics, and others can improve nurse productivity by using a lean framework to eliminate waste and create value. Nursing leadership can partner with the informatics team to develop specific strategies to reduce documentation requirements and therefore increase time nurses spend caring for patients. If nursing informatics is not your forte, don't worry. There are a lot of excellent nursing leadership resources available to assist you in your journey and quest for knowledge. A simple library search will elicit thousands of articles on technology and the nurse leader. However, don't be overwhelmed. As you will learn in an upcoming module, your search for knowledge can be efficient and manageable. The key is to know that you are not alone. We are all learning together. In 1999, the Institute of Medicine released a report titled, "To Err is Human, Building a Safer Health System." To Err is Human asserts that the problem is not bad people in healthcare. It is that good people are working in bad systems that need to be made safer. At some point in your career, you have most likely heard reference to this report and its ultimate consequence on our healthcare system. Since 2000, with congressional support, the Agency for Healthcare Research and Quality, or AHRQ, or ARC, has invested heavily in patient safety to assist doctors and nurses in their efforts to keep patients safe when they receive medical care in hospitals, physicians' offices, nursing homes, ambulatory surgery centers, and other settings. AHRQ tools take the what and translate it into the how by providing research-backed, practical tools that doctors and nurses can use to improve care. Nurse leaders invest in their fellow colleagues and staff by implementing ARC tools in their nursing unit. Building relationships with the quality management department in the healthcare system will ensure that patient safety is the highest of priorities. Nurse leaders know how to invest in collaboration and partnerships with not only their nursing colleagues, but other healthcare professionals within the hospital system. There is no greater satisfaction than when an interprofessional team works together in a crisis to save a life. Likewise, it takes daily teamwork to care for patients and provide comprehensive care. Our colleagues in medicine, the laboratory, diagnostic imaging, pharmacy, and other nursing departments in the hospital work synergistically to provide for our patients. So where does research come in? Implementing healthcare research through academic and clinical partnerships lead to enhanced patient care treatment options, safety and efficacy of procedures, and improved patient outcomes. The nurse leader encourages her nursing colleagues to collaborate with these partners. Even though our profession has made impressive strides in research over the past few decades, we will always need more nursing researchers. Our professional reputation will continue to grow with collaborative, active involvement from the nurse's perspective in healthcare research. Next, we're going to discuss the importance of participation in professional nursing associations. Why join a professional nursing association? What advantages can be derived relative to the cost of membership? According to the American Nurses Association, or the ANA, professional development is a vital phase of lifelong learning in which nurses engage to develop and maintain competence, enhance professional nursing practice, and support achievement of career goals. Membership in professional organizations can bring you together with practitioners and researchers across the globe. Conventions, conferences, webinars, websites, committee meetings, mailings, social media, journal, chats and forums, and newsletters are all ways to engage and network with peers across the country and globe. Through these activities, you can broaden your understanding of evidence-based practice applications and scholarship in your field of interest to benefit your agency and community and the patients you care for. Many specialty certification boards require you to take continuing education, or CEs, courses to stay up to date in your practice. Professional organizations offer CE activities to members at reduced prices to meet these requirements. Professional organizations offer discounts to certification review materials, nursing products and services, auto, life, and professional liability insurance, and may feature special financing offers. Many nursing organizations offer members an official journal that may contain peer-reviewed clinical articles and research relevant to the specialty. These associations also offer career advice and job opening platforms. On this slide, you will see listed a few of more than 100 nursing organizations. The American Nurse Credentialing Center is home to the resources needed to become certified in your specialty. In addition, the National Certification Corporation has additional nursing certifications awarded to nurses in obstetric, gynecologic, and neonatal specialties and subspecialties. Other certification specialties are included at nurse.org. Yes, certification in nursing requires a time commitment to your specialty, some significant study time in preparation for the exam, along with the expense of the certification exam. Once you have that exceptional feeling of accomplishment with the certification in hand, it will all be worth it. Certification in your specialty demonstrates that a nurse has the knowledge, skills, and attitudes to provide high-quality care to patients and their families. Certification shows that nursing is a profession that cares about safety, quality, and excellence of healthcare delivery. In addition, many healthcare systems or organizations pay for certification preparation exams and test fees, and they reward nurses with hourly certification differential pay. This may or may not be in conjunction with the clinical ladder system. The clinical ladder is a structured system to provide nurses career advancement while remaining in their current clinical setting, providing direct patient care. It is used to recognize professional development and differentiate between different levels of nursing care and expertise. Not every hospital system utilizes a clinical ladder or its equivalent. This may be a consideration when considering your healthcare organization for employment. The Magnet Recognition Program designates organizations worldwide where nursing leaders successfully align their nursing strategic goals to improve the organization's patient outcomes. The Magnet Recognition Program provides a roadmap to nursing excellence, which benefits the whole of an organization. To nurses, magnet recognition means education and development through every career stage, which leads to greater autonomy at the bedside. To patients, it means the very best care delivered by nurses who are supported to be the very best they can be. As you can see, the next two slides list a numerous amount of references for your benefit. Lastly, we'd like to acknowledge our program funding, and we wish you the best of luck on your nurse leadership journey.